This is United Medical ACO weekly event. And my name is Kemal Erkan. I'm the chairman of United Medical ACO. We're going to try something new today. Real people, real perspective, reality of COVID. So now what we are trying to do. So one of our client managers, Katie, came to me last week or early this week and give me some feedback from these events, and she suggested some stuff, and then I said, well, how about if you do something like this? And then something like this is now coming up. So we asked 5 different individuals, so there will be 7 of us. Now I see Susan, I don't know if she's joining us, but she's welcome to join us. And guys, if you can unmute yourselves and you can turn your videos on. There we go. So, and there's Muriel. Muriel, that chair looks so nice behind you.
It does. Nice and empty.
Well, I was kidding. Is Susan not coming? So was she just sabotaging our Zoom?
I'm not sure how she got the link.
I think she maybe just took the Zoom from my calendar, which is fine. Okay. Now, Katie is the troublemaker here. Thank you, Katie, for that. I did actually really initiated by her, and I maybe put a different spin on it, and then now we are going to try this. So again, I'm the chairman and CEO of United Medical and United Medical ACO. Now, these individuals, they have different responsibilities in United Medical. Now, can we do this with different people, more people? Absolutely. And then we can do more next week, the following week. But the idea is not necessarily just what we tell them, what we tell people, but what people are thinking. And people are the people that you see here on the screen right now. So, and how much you want to disclose is up to you guys. So I'm going to start with me. And then I did actually kind of, I did go over that a little bit, but I was one of the first COVID cases, probably, as I was trying to protect the public. I sent people home that day. If you guys remember, that was the end of March 2020. And we started working from home, and apparently the problem was at home. So when first day that I worked from home, I got my COVID. So first week of April, and went through that for 10 days, no problem. Did a lot of education throughout the time to understand what we were going to have. Vaccine was a problem in the beginning. And if you guys remember, there was a TV interview in September. And I was one of the people who said, if the vaccine is too early, I may not be taking it because I have to actually see if it works. And then my safety net for me is, or what made it okay for me is all of my providers that I trust, my physicians who are part of our network, they get vaccinated at the end of December, early January. And then I'm like, okay, so this is safe. And then I told my family that we are able to take the vaccine, we are good. So then I got my first dose and second dose. And whenever my provider tells me that I'm going to need a booster, then I'm going to get that. Now, and we have 3 guys here and 4 female employees. So I just want to get different perspective from you. You may all have different issues personally with the vaccine. If you can just give us where you are and what you think of the vaccine and what your perspective is. So we can maybe start with Richa.
Sure, come on. Can you hear me okay?
Yeah.
Okay, perfect.
So, where's Richa actually? Where is she now? Like, she's not home. She's not in the office.
I'm in New York City.
Right.
Yeah, which it's not a secret. No, it is. It's beautiful out here. I'm just joining from here. So, yeah, I did not get COVID. I actually was one of the first people, lucky enough people to get vaccinated from our clinic, from United Medical Clinic. So I was vaccinated in January, and then I had my second shot in February. My husband works in healthcare. He works at the hospital. So he is in contact with patients who may have COVID. He does not work in the ED, but he has definitely had to do emergency cases on patients that, were COVID positive. So for me, my perspective on the vaccine to get vaccinated was, number one, protect myself because my husband is working in a healthcare environment, and also protect my parents. I have a 71-year-old dad and a 66-year-old mom. So I want to protect them. That was my number one priority. In terms of Kemal, some of the issues you were talking about where there was all these reports of it affects your fertility, it affects this and that. For me, I wanted to make an educated decision and go with science. And science was telling us at the time, my doctors were telling me at the time, I'm going to be 36 years old. They were all telling me, you should get vaccinated because the most important thing is that you don't get COVID. If you get COVID and you get severe COVID, you're in a predicament where you may be hospitalized. So I took that as more of an important factor versus all of the other reports that were saying, this, that, or the other. So that's my perspective. That's where I stand. My entire family is vaccinated as well, Kemal, just like yours. So we are just trying to do what we can to protect ourselves. And I don't think that any of us have more knowledge than the experts. We have to follow the experts. They are the ones that are in the field, know it. And my opinion is my opinion, your opinion is your opinion, but we need to go with science and we need to go with experts and facts.
Great. Muriel, we can continue with you.
Okay, well, my experience was I did get COVID towards the end of June. It was pretty bad. So when I heard that the vaccine was going to be available to us from our clinic, I did not hesitate to take that because I figured, for me personally, I would rather take any small, minuscule risk than get COVID again. So I knew if there was any chance that I could be protected, I would take that. So that was my first thought. My second thought was, well, if I get vaccinated, then at least I'm protecting my family. It's the responsible thing to do. And then also the public. So I didn't really have any hesitations with getting the vaccine. And I agree with Richa. I trust the science and I trust the medical experts with the information that they've provided to us. But that's my experience. That's my thought process.
So do you mind if I ask you one other question?
No, I don't mind. Go ahead.
So something else happened, right, during this time?
After I got vaccinated?
Yes.
Yeah, after I was vaccinated, about maybe a month later, I found out I was expecting. So currently I'm in my 7th month. And so far, so good.
So congratulations. So you are pregnant.
Thank
you. So not only it doesn't affect the fertility, but you are able to get pregnant. So we have a proof, maybe. So thank you for sharing this.
Of course.
And you are doing 2 months then, right?
Yep, I'm due in October.
And also, we already have one COVID baby, but he's not on the call today. So, so let's continue with Kosivi.
Thank you. Can you guys hear me okay?
Yeah.
Yeah. All right. So my experience. So first of all, my name is Kosivi Uluko. I'm part of the business development team as well. My experience with COVID in itself is back in around Christmas time. I did actually contract COVID. It was pretty mild for me in terms of like the severity of like my cases. I was very, very tired for the most part and lost my sense of smell, but not my taste. Thank goodness, because I love food. But I was down for a while. And I just continued just to test positive. I felt fine. I was able to work out. I was able to kind of move around, but I just kept testing positive. So when I spoke to the doctors, obviously I was having my regular provider appointments. They were just telling me, sometimes you will continue to test positive because there's a lot of dead cells that are just there. But, just continue to take precautions and make sure that you are, being as safe as possible and trying to be healthy. So they did even advise me, if you are feeling okay, continue to be active and be, they're promoting me being healthy and boosting my immune system. It was a way for me to battle against COVID. So after I finally tested negative, it's been a bunch of times now, and every once in a while I would get like an antibody test, and if I am currently not vaccinated, I'm okay to share that. It was my choice because of my current status, because I did have COVID, and I still have antibodies, and and the purpose of getting vaccinated is to have antibodies against this virus. So if I feel that I have current antibodies, as well as somebody else who doesn't, I should be okay. And I'm protected, and I want to make sure that my family is also, they'd never had COVID, so they got vaccinated, which to me was good because they now protected as well. So I am not against anybody who did not have any COVID infection or does not have any type of antibodies. I think you should try to protect yourself and, have these antibodies protect your family and those loved ones around you. But currently I'm not vaccinated just due to the fact that I had COVID and I have antibodies. There's not a lot of research in terms of whether or not I, should get it, but there's recommendations to get it just to be extra safe. But I feel pretty safe. And just looking back into,
I guess maybe question is if your doctor insists you getting vaccinated, you probably would be getting it.
If my doctor insisted on that, I would definitely highly consider it. But at the same time, if they're looking at my results and they're seeing, you still have antibodies, and there's been no consistent advice for me to go and get vaccinated, then I wouldn't even consider, because I'll just continue to do what they told me to do when I did have COVID, was to boost my immunity, to live a healthy life. And I increased my exercise. I actually started eating a lot better. For those of everybody here on this line knows the type of way that I eat. So I actually started, really taking that seriously, and I felt better, ever since. So I think that's one of the things that is kind of missing from the conversation, is promoting healthier lifestyles, honestly, because a lot of the people that were hospitalized, that were in any type of serious conditions, most of those cases were people that have those pre-existing conditions, where a lot of, let's say obesity or any type of things in the past may be high, maybe like high on that list. So if people were able to take that time, from that year we were all at home and start promoting a healthier lifestyle, because nobody discussed that at all, I think we will see a lot of these hospitalizations go down. At the same time, it'll be maybe double the time with the vaccination that's available. So those who can't get into those healthier lifestyles get vaccinated, but those who can actually take the time, there will be a lot less hospitalization, I would think so, if we can promote healthier lifestyles.
Actually, that's an important point. And Kusiri, you are one of those people who are helping us to do the Monday and Thursday presentation for our providers. And from our COVID study statistics, what we know is about 60% of the patients have either obesity or morbid obesity. So that actually does suggest us that a healthier lifestyle or treating obesity is important, especially during this time. And that's really important. So we don't want to actually delay any of those. That's a good point. Thank you. So Christina, so we can continue with you.
Hi, you can hear me okay?
Yes.
Mm-hmm.
Okay. So I have not had COVID, and I did get vaccinated.
So I'm sorry, you said did you, or you did, or
did
you
not.
You did not?
I've never had COVID. I did get vaccinated as soon as it was available to me to get vaccinated. I have asthma, so that was one of the primary reasons for me getting the vaccine, as well as a lot of members of my family also have asthma. So we wanted to make sure that we were protected. I wanted to make sure that I was not going to be, hopefully, or I wasn't going to be causing issues with any of my older family members as well. So everybody, or almost everybody in my family at this point, is vaccinated.
And no, that's good. And now, Katie, so as the troublemaker of this session, thank you for bringing this up. So this was a great idea. So tell us about what's happening with you, what your perspective is.
Sure. So I got COVID last July in really the second wave of the peak of it, right after Muriel, actually. And for me, it wasn't terrible. You know, I had most of the routine symptoms of I lost my smell, I lost my taste. I was really tired. Took me about 2 weeks to recover, but that was last July. So originally when this data was coming out, they said we weren't sure how long the natural antibodies would last. Maybe it's 3 months, 6 months. My mom was an organic chemist. I've gotten vaccines growing up, and I'm very much an advocate of vaccines, but I wanted to see how this played out with the recommendations. So fast forward to it's now August of 2021. And last month, I went to have my routine blood work done for my physical, and I also got an antibody test. And it came back that I still do have active antibodies. And for me personally, I have not gotten the vaccine at this point. Like Kosivi said, the point to me of the vaccine is to protect the community by having an immunoresponse. The point of getting vaccinated is so that you create the antibodies, create the immunity so that you are not contracting the vaccine. So as somebody who has those antibodies and has that immunoresponse, I don't feel that, you know, when we're talking about mandates, I don't think that it's something that I want to get at this time. Am I opposed to getting in the future? Not necessarily, but I don't believe that that should be mandated for me. And part of why I brought this up is I don't hear about this at all. I'm hearing about people who are saying you don't care about your community if you're vaccinated. And then I'm hearing about people who are not vaccinated at all. So I think it would be interesting that if you do get vaccinated, you get that card, right? And so you can go and see a Broadway show, for example. I know Reach is in New York right now. If a person gets vaccinated and doesn't necessarily have, you know, a quite strong enough immunoresponse, they can still participate in events. But I, as somebody who's not vaccinated, but still who has that response, cannot go see that show. So that was part of my issue with this. As long as what Kosivi said, it definitely is a big health factor. I agree with that as well. And I think also I can speak for me, and I can empathize with people in my situation, people who have had COVID, who are active with antibodies, but I necessarily can't speak for Christina. You know, I'm not in that same situation as her. I'm not in the same situation as Muriel. I'm not expecting. So I just really wanted to bring light to that there are different categories of people at this time, and I don't feel like that's being discussed.
All right. So, Tanner,
Kemal,
go ahead.
And Kemal, I was just going to say, just to add on to what Katie was saying, especially with the being able to have these mandates, what we're going to end up seeing is a lot of false reports. People are going to start grabbing fake vectors, nonstop things online. fake vaccine cards to be able to go and see shows and plays, which I think is just causing more of an issue.
So do you remember like a couple of weeks ago when I came to you guys with one of the patients, the surgical one, and then I was freaking out because the patient was positive after 2 vaccinations, and I wasn't happy with what we have on the chart. Luckily, it was correct, but the proof was not like so reliable. So if that's the proof that we are taking, then everyone can actually produce that somehow, because we are the fake ID heaven, and the college, they're trained in college already. So it won't be too difficult for those millennials to just have the fake vaccine IDs. And I'm not suggesting that they should, but that's a good point. So, and I was just reading that actually a couple of days ago. Tanner, if you don't mind just sharing yours as well, so then we can kind of close this.
Yeah, no problem. So I personally did not have COVID or contract COVID at any point, although it did hit home pretty close on multiple different occasions. So it started early on. It was really affecting livelihood, of course, for everyone at the time. But what I was really worried about as the pandemics were really progressing and starting to get worse and worse over the summer, things were getting obviously shut down. We weren't able to go and gather with friends and family. At the time when a roommate of mine actually contracted COVID, it was right around the time one of my best friends who had pushed his wedding off 2 times was set to get married, and I was in the wedding but ended up having to miss it for a quarantine. And then after that, I had my girlfriend had both her parents pass away from COVID. We had a lot of it in the family. There were some other personal problems going on in some of my extended family. So I knew I've never been one of those people that it didn't have to affect me to know it was real. I know that it's real and it's happening everywhere. It's affecting people and their families on so many different levels. So that was never an issue of mine. Not that it happening to me was what really triggered it. But I knew from just personal experience that when I was given the opportunity to be able to protect not just myself, but those around me, if it were to, like we've been discussing it, have those antibodies to not make sure I'm not contracting and then spreading in my friends and family's group, my immediate circles that I was being able to still hang out with, I knew I was going to get it. And then when it was made available to us and we had the opportunity to get it early on, right when I was able to, I knew for someone in my situation, and then talking also with my doctor, of course, it was recommended. So I knew that it was the right time for me to get it. So I just wanted to make sure that I was going to be okay, not actually be able to have those antibodies created. But if it was through the vaccine, then that's what was right for me at the time. And I feel like I'm pretty confident in that choice, especially now that my family has started to get vaccinated as well. And we're able to start to see each other again and get into have some of those larger gatherings and get back to some sort of sense of safety when it comes to big family gatherings, big family functions, and making sure I'm okay to go into situations like that.
So no, this is kind of like if you were to kind of summarize this. So we have 3 men, 4 women in this call, ages from 24 to 47. I'm not going to tell you who 47 is. So 4 people had COVID, 3 people did not. 5 of us are fully vaccinated. 1 of us is pregnant, and 3 of us were planning to maybe get pregnant. And out of those, 2 are vaccinated. So, and in our company, vaccine is not mandated. My goal was to make the vaccine available because we are outpatient and we are the business office, so we were not in the first batch right away. So we had to kind of put pressure on the state because hospitals were they were on the first line, and we were saying that we are providing the support, we aren't providing the care, we have to be vaccinated. So that was kind of our issue. Our first fight was we want to get vaccinated, but now our fight is on the other side where people, not people actually, I think the politics maybe makes it a little bit muddy, where science is kind of like covered by politics, and then the opinions of the different sides is making this difficult to clearly see what may be available. So I don't like the mandates. And just between 7 of us, I know if it was mandated, if United Medical was to mandate this, we would probably lose 2 employees. That's how I feel. So that's why it would be irresponsible for those other companies to make these decisions without engaging their employees, because everyone's situation is different. So 7 of us, we have different stories, and we work in the same office. I think that's maybe a perspective that we are trying to give from this. And I'm hoping that people can understand this, just to kind of hear it from different, like we don't have one set agenda. So we are trying to give different perspective of what's happening, and we don't have the answer. All we know is we read, we try to learn more from the scientific events researches. So as soon as the pregnancy research was available, the first thing is we read it. So, but until then, we didn't have any references. Now we have. So that's how we are processing, and hopefully this was helpful for those who were looking for different to hear a different perspective of COVID. So, well, thank you for joining us. Thank you for being part of this. This was really important, and we'll be back next week. This week we don't have the Bariatric Friday. Dr. Erkan is off this week, but next week we'll be back with 2 events. And we'll see you next week. Thank you so much. Have a nice weekend.